Hello, everyone. This is Coresair Mack, President of the Illinois Mental Health Counselors Association, and today I'm joined by our very own Dr. Carmen Ochoa-Galindo. How are you doing today?
I am doing good. Thanks for asking. How's it going with you?
So far, so good. I'm still awake, right?
Right? Right, I
Mhm.
know.
All right. So, and again, congratulations on winning your award at
Oh my
ICA.
goodness. Oh yeah, it's still surreal, but very, very exciting.
So now, believe it or not, you have a lot of fans, and they want to get to know you and know all about you.
Great. I mean, hey, let's go for it.
All right, perfect. I like it. Let's jump right into it. All right, so all your fans want to know, how did you become interested in counseling?
It's that's my students at UIC, they asked me the same question, and mine was really more by accident. I didn't really have a plan. When I went to UIC, I was undecided, and you're
Hmm.
allowed to be undecided up until junior year. And so then I took Psych 100, and then Psych Abnormal Psych, and I just kept taking the classes. And I'm like, oh, I really enjoy this field. And so I just majored in psychology, and um, that kind of started my path down the counseling aspect of it. And I've always been like the one that my friends talk to, good listener, and already like the empathic skills and the validating and all that. So I guess it wasn't too far of a stretch for me. I just wasn't like, oh, I'm gonna be a counselor. It just kind of happened by accident. And the interesting thing is that back when I was in graduate school, there was an option for people that were getting their master's in psychology. If they took 3 or 4 more classes and did an internship, then they would get a certificate in counseling. That doesn't exist anymore.
Oh,
Yeah, we were the second to last. This was back in 2007, 2008. So this was we were the second to last class that was like graduating like from that, like they were removing that option.
mhm.
So I actually feel like I was very lucky. I was at the right place at the right time, that I was able to benefit from that. And so that helped me to then just transition to counseling.
Oh, wow. Okay. I did not know that at all. So that's very interesting.
Yeah, yeah. I mean, the state of Illinois took that away, which is kind of, I mean, again, I'm sure they had their reasons, but it was nice because it was, I guess most of the classes are kind of, similar.
Mhm.
And so they just like, well, you just need a few more, and then the internship aspect, and then you can, you know, you can sit for the LPC if that's what you want. So I took advantage, and then then after that, 2 more years the LCPC. So that's kind of that what my journey was.
All right. Nice. Very nice. So then, speaking of that along your journey, so what school did you go to for your undergraduate and your postgraduate degrees?
Yeah, so I went to UIC for my bachelor's, and now I teach there, which is a bit surreal because some of my professors are still there, and so that I'm sure they felt something when I was like, oh, you were my professor, now you're my colleague. Yeah, so a few, not a lot, but so that was my bachelor's, and then for my master's, I went to National Louis University.
Mhm.
There's a few campuses. I went to the one downtown on Michigan Avenue. And then for
Mhm.
my doctorate, I went to Argosy University. And I took breaks, between each degree. Um, so
Okay, so then, a one-off question then. Favorite class in your doctoral degree program?
I always like the psychopathology. I like those kind of, classes. Like I think I took a child and adolescent
Mhm.
that like therapy class or something like that. I can't remember the exact title, but I always enjoy those
Mhm.
kind of courses where you're kind of learning how to work with specific population. And I remember taking one that was specifically for child and adolescent. So
Okay, that's cool. So then,
yeah.
I mean, true, when it comes to your doctorate degree, you put in, I bet, a lot of work, sweat, blood, tears, and all that other fun stuff that goes along with it. And thankfully, you have your doctorate to show for it. So I guess another one-off question I have for you is, what did you do your doctoral thesis on?
Yeah. So it was on Mexican immigrants' perception of counseling. And so I wanted to, being Mexican American myself, I know there's a lot of stigma and taboo still with mental health, and I'm not crazy, quote unquote. So I was looking at just kind of their perception of what will people think. I mean, that's a
Mhm.
big kind of like the stigma of what will others say, because I see that a lot when I work with this population of like, what's so and so going to say, what my aunt or my mother, what my, and so that I passed out questionnaires to a sample size of Mexican born immigrants here in Chicagoland area, and then also kind of gave them a questionnaire on um like beliefs about the stigma of mental health, and whether they've ever been to counseling. And I was my hypothesis was that because of that belief of like what will people think,
Mhm.
the stigma, that they wouldn't be as open, or they either wouldn't be open to it or have not gone to counseling because of that. And I believe it was supported with what I have, the data that I found.
Wow.
Yeah.
Oh, wow. That's pretty intense. I'm not gonna lie. Right? Better use
Yeah. I mean,
all that.
we see it in a lot of different communities, just unfortunately the hesitation
Mm.
of seeking services, and you hear, and again, a lot of it is just not understanding what counseling is and what it's not, right? So, I kind of want to explore that further, and with that population, because being bilingual in Spanish, I work a lot with Hispanic clients, and so I see it a lot, the narrative, so
Oh yeah, definitely. Especially with communities of color, you definitely see that a lot in there. So I
yeah.
100% can relate to that. So perfectly segue into the next question. So what places did you start off working in your profession, and what did you learn as a result from working at those places?
Yeah, so well, for my bachelor's, we had to do an internship, which is always not, the norm. A lot, not, I don't think a lot of bachelor programs maybe have that option, but UAC
Yeah.
does have an option of being able to do a bachelor level internship.
Mm.
And so I did it at a domestic violence agency, and that's actually a population that I continue to work with throughout my master's internship was at a different domestic violence agency. And so trauma was something that I was, you know, uh, exposed to, or, working with that type of population, a lot of trauma, unfortunately. So that was kind of the first taste of working in the field. But one of my other first jobs was with a bachelor's, was being a case manager for foster care.
Oh.
Well, I hated it. I mean, I'm not gonna lie. I'm not gonna lie. It was tough. I mean, it is just the courts and these. I don't know how it is now. Was back in like 2004. It was very grueling because you just stepped in to the caseload that was there, and you already had to go to court, and you haven't even met the family. You have no idea what happened, and the judge doesn't care. They're just asking you, "This happened 2 months ago," and I'm like, "I just started 2 weeks ago." Like, I don't even. So it was just very, for entry level. Like, I got gray hair. Like, it was just it was tough. Like, and again, it on taught me a lot also, and you really have to be organized. You really have to make sure that you have all the documents that you need. A lot of it is, again, preparing for court and doing assessments, and it was tough. It was tough. Um, I can see why the turnover rate for that kind of job is just it's tough. It's a tough, and again, also a lot of trauma. You really have to. Some of the stories that you hear, it's like, I don't think animals treat their babies, that poor,
Mhm.
it's definitely not for everyone. So yeah, it was tough. And also one of my other, as far as, because I also teach, one of my first jobs teaching was, I was in Mexico, actually teaching at a university English as a second language to students. That was part of, they couldn't graduate unless they took the course.
Mm.
So they had, or took if they were already fluent, they just took the exam then. But so there was two options. So that one was a lot of fun. I mean, obviously challenging in itself, but a lot of fun as well. So, but those were like my first psychiatric hospital, working in a milieu. I think those are kind of like the higher, down when you're entry level, right? Like
Oh yeah.
kind of paying your dues, so
Right. Baptism by fire. That's what we always like to call it.
yeah, but it's great experience, that's why I say it's like, it's great experience. You learn a lot but definitely, yeah, it can be challenging.
Mm-hmm. I 100% agree. Right. Don't get me started on my stories because, oh boy.
Oh, I know. It's funny when you like meet colleagues, it's like everyone has a story, everyone can relate, can share,
Mhm.
like anecdotes, because it's just, and I tell my students, one of the things that students like about my classes that I share, like hit not just the theories, but what I see in the field. And it's like,
Mhm.
I wish I had an imagination. Like these are true stories of like, just, I use pseudonyms obviously, or just, Jane Doe, but it's like, these are actual like things that I've seen, and it's not, I wish I was making this up, like I was
Mhm.
just imagining, fictional characters, but these are actually, true stories.
Oh yeah, definitely. They really are. So, working in those types of fields, and, like you mentioned, earning your dues and things like that, eventually that led you to working for, like you mentioned, you worked for the University of Illinois, Chicago. And then I believe you also worked for North Park University as well, right?
Yeah, right. I'm actually gonna start. I took a little break, and then I'm actually starting back in January, at North Park again, with their
Mhm.
practicum,
Oh, yeah.
class. Yeah.
Oh, very nice. All right. So, how did that transition happen? What led you to work for the universities and out of, case management and things like that?
Yeah, well, again, and once you pay your dues and you have your license, you're like, okay, I can do some other stuff, right? That's not like
Yeah.
so just stressful, I guess you can say. But and I actually, because I taught in Mexico, I believe that opened the door to me being able to teach here when I came back to Chicago. You can teach with a master's degree at the community college level. And that's where I started. I started at Morton College in Cicero. I was there just as an adjunct, on and off, one class here, one class there. And then from there, I also taught at National Louis, again, I've always been adjunct. And it wasn't until I worked at San Xavier also
Mhm.
for university as an adjunct, but I was more stable. It was always two classes a semester. And for me, it's a nice balance of like therapy, being a counselor and then being a professor. For me, it keeps it fresh. It's like not the same thing every day. Like I can, switch it. And for me, it helps with burnout, like to prevent burnout a little bit, because you can kind of get a break. Okay, now I'm teaching, or now I'm doing counseling. And then it just presented itself that they were hiring at UIC. And I was like, oh, and this is what I tell students, never like sell yourself short, because you're not even
Yeah.
giving yourself the opportunity to be considered if you don't even send the application. So you're already like shooting yourself down, because I was like, well, I don't have any research experience, because UIC is very research oriented. But I didn't realize that there's also what they call lecture. I'm a senior lecturer because I've been there now for 4 years. So lecturers, they don't have to do research. It's more of just the teaching. And then you have your tenure track. So there's different, I guess, positions. And so I just submitted my application, and a couple months later I got called, and I was like, oh my goodness. And then went on the interview, and
Yeah.
still, I think very like imposter syndrome of like, okay, I'm going on the interview, but there's no, I don't even know how many they're interviewing. And then I got offered the position. It was very, again, like, humbling too. I was like, oh my goodness, I can't believe it. And with North Park, it was around the same time. I was just like, oh, this is for their master's program. I had never taught at the master's level. And so I was like, well, again, what do I have to lose? And interestingly enough, I didn't even interview for that. They just offered it to me.
Oh
So,
wow.
which is, I mean, we had a conversation. I mean, I met with him,
Hmm.
and we met, and I'm waiting for like the questions and like the interview. And he's just like, oh, well, what classes would you like, would you be able to teach? And are you available? And but it was very informal. And then I was, sent the contract, and so I always tell students, you never know, like you don't even you can't like consider yourself not a candidate because you never know what they're looking for. So, but that's kind of how it happened actually. So it was just, again, just applying, seeing that there was an opening, and yeah, following through with the interviews and all that. So,
All right, very nice. Well, you heard it here, folks. Just apply, keep your fingers crossed, pray, and don't sell yourself short.
right, everything that you do, right? Like, but at least, but you have to do your part.
Mm-hmm.
Because again, it's wishful thinking, but if you're not even doing your part, then you're the one that's, like already dismissing any opportunities.
Yeah, that's true. I feel like, well, then again, I might be generalizing counselors here, but I feel like we're so modest, right? And we're like, oh, we can't do this, or oh, we can't do
Yeah,
that, or oh, we just like super humble ourselves out of an opportunity. But
exactly. I
just like you
agree.
mentioned, right? We just
Yeah.
got to go for it, and then whatever happens, happens.
I mean, the worst case that you don't get called. Okay, like it's not, you know what I mean? Like you just then you move on, but you're not even putting yourself in the running, right? By not sending your info. So you just never know. That's what I'm saying. Like you're already making that decision for them by not submitting it.
Yeah, exactly. Right, perfect. So then, I don't know if you could say this, I might be getting you in trouble with your universities, but who knows? We'll see. So then, what is your most favorite and least favorite class to teach there?
Yeah, yeah. Oh no, no worries. Yeah. UIC has two tracks. So they have with the bachelor's in psychology, there's a general track and there's an applied. And so with the applied classes, it's more hands-on,
Mhm.
more so you have to take 3 more classes. And so that would be, I think, the psychological testing, and then either psychological interventions or interviewing, psychology of interviewing, and then you have to do a practical. It's more, none of that. So it's just more the classes. So I do more, I teach more of the applied, which is great because again, I'm teaching like psychology of interviewing, psychological interventions, the practicum, which is all the stuff that, it also helps me keep, refreshing like techniques. And when you're talking about like empathic listening and all that stuff, it's like a review for me as well. So any of those classes are always, nice to, it's just refresher. And also, I mean, we actually changed the title from abnormal psychology to introduction to psychological and behavioral disorders.
Mhm.
So I think a lot of universities are moving away from the title abnormal psych, again, because it's already kind of assuming something, right? That it's abnormal.
Right.
So there's a push, and I think some publishers too are trying to change the name of the textbook, because most textbooks for that course is abnormal psychology. That's the title of the book. So there's a that's kind of like a change in that. So that's another one that I really like teaching because it's everything I see at work, as a counselor. Every week is a different chapter, anxiety disorders, mood disorders, right?
Mhm.
Substance use. So it's always, again, it's nice to teach those. The one that I don't say that, I guess, is my least, but and I'll explain why. And I've taught it a few times. It's psychology of women and gender. And the only reason why I do enjoy teaching it, but if I had to rank them, that'd probably be at the bottom. It's because, again, it's I feel like I really have to be careful about just some of the topics in that class, and not offending anyone. I mean, that's in general. And then that's a whole other, conversation of like being politically correct. But I think I sometimes feel like I really have to like be on, making sure that I am addressing, certain topics, and making sure that I'm inclusive, and just because that's the stuff that's really heightened in that course.
Mhm.
So it's always a little bit, it's just challenging at times, and making sure that people are respectful of, because people that class is 150 students,
Oh, wow.
so it's one of those big lectures. So I mean, opinions. One time, we were talking about the real quickly, the
Mhm.
the pay gap between men and women, the pay gap, how, for 80 cents, a woman makes usually a man makes $1. And it's very few males in that course. Out of 150, there must be like 10, maybe. Everyone else is usually female, right? And so a very brave male student raises his hand and he's like, well, the reason why men make more money than women is because they work harder. And I thought, and then you just heard a result. Honestly, you heard like like from, I was like, oh my God, they're gonna beat him up because everyone was, you know what I mean? So it just gets very, and you're trying to make sure you're not. And again, I mean, I identify as female, so I'm just like, I can't believe he said that in front of a female team. So, and so I'm like, well, where's your proof? Back it up, because that's the thing too, is that they're always looking for where. And I actually did my own research and I put articles on Blackboard, which is what we use for the course. And I'm like, I tried to be objective. Like, I didn't find anywhere any research that supports that. I said, you're saying, then you need to then provide your citing, your research, your like sources, right?
Yeah.
So anyway, it's just the topics that discussed can be very, I always kind of give that disclaimer, like, we don't have to agree. Right, we can agree to disagree, but we're so it's just being mindful of those things. So it's always a little when they ask like, you want to teach this one, I'm like, oh, okay. I'm like, so, but again, it's still a learning experience for me as well, so.
Oh yeah, definitely. Well, I'm glad you made it through that. I'm glad the student didn't get beaten up. Right.
I know. I'm like, I mean, if they had tomatoes, they would have been like, or something. I'm like, I'm like, I'm gonna have to escort him out of the room. Like, it was just, I mean, and that's the thing. I try to use sense of humor because it's like, otherwise, if we take everything so literally and seriously, then we're just, you know what I mean? Then we're always going to be too stressed out about everything.
But no, that's good though. That he was able to share that. You all were able to have a conversation around it. You provided your research and supporting evidence. I don't know if he had any research and supporting evidence.
Well, he cited someone. And I'm like, well, I'm like, okay, let's look it up and let's kind of, we'll come back to that. But yeah, no, I mean, and that's the thing, is that it's a open forum, right? I mean, people are entitled to their opinion. But yeah, I'm just very, again, 95% female in the lecture hall. So just was pretty brave to say that, I guess.
Right. Well, I bet they had a long discussion about that.
Oh yeah. Oh yeah, definitely.
All right. So speaking of discussions, perfectly segues into the next question, or I don't know if it does or not. I'm probably just being dramatic. All right. So you work for a place called In Motion Counseling.
Yeah.
So what led you to work there?
Well, so it's a private practice. I think it's been maybe 4 years that it started 4 years ago. And the owner, of the private practice is someone that I worked with in community mental health. So we kind of go back, and we each kind of went our separate ways, but kept in touch. And then through social media, saw that she had started her own private practice and was looking for clinicians. And so we got along great because we worked we worked at PCC, Community Wellness Center, which is a community clinic, and there's different locations. We worked at the same location and shared an office. So, I mean, if you spend time together, you get to know each other, and we got along. We have a lot of similar background as well, experience. And she asked me to, are you interested? I said, sure, yeah, because I was looking, again, I wasn't really, I had my twins, and so I took some time off, about a year or so. So I was kind of looking at, okay, I want to go back to something part-time where I can start doing counseling again. And then that's, kind of like perfect, timing there. And I believe in like the work that she does, the mission of, because I don't do these type of sessions, but what they're called walk and talk, which is actually something that's a more growing area of counseling, where again, it's kind of like helping them, like helping clients with like the behavior activation component. And so you're actually doing a session as you're going for a walk in the park. And there's, ways to obviously do that. And, but I know she does that, some of the sessions, she'll do the walk and talk if the client is interested, and if it's, clinically appropriate, then they'll do the session while they're going for a walk. And so I think that's, great to kind of, the whole like in motion aspect of it is, get people moving. And I think unfortunately too, because of the pandemic, a lot of, being remote, which again has its advantages, but definitely getting people to start moving again, so I just thought it was a great platform, to kind of go back and start doing the counseling again.
All right, great. So you heard it here first, folks. Work at In Motion Counseling. They'll get you walking.
Right? It's like you gotta walk and talk. We can do that, right? So.
All right, perfect. Now that you said enough to get your promotion and raise, I think we're good
right.
now. All right, so then speaking of In Motion Counseling, are you currently working on any projects that you want people to know about?
We're always open to, whether it's doing presentations or running groups. The thing is, kind of right now waiting to promote them more, but a specific project, I help with the director of quality and assurance. So I'm always doing like behind the scenes, making sure that, people are doing, we're complying with like how the notes should be, for insurance and running reports. And so that's always kind of like ongoing. But we are happy to, I've done presentations for different schools on different topics. And so that's kind of always, something that I'm working on, different titles of like seminars or psychoeducational top groups that we, whether it's a school, whether it's an agency, hospital would be interested in. That's kind of like my area that I also like to do. I do a lot of like in whether it's Zoom or in-person presentations. I like doing those. So, whenever someone's like requesting, we'll start working on it. So, we're kind of in the middle of kind of seeing if some things, pan out. So.
All right, nice. Well, you heard it here, folks. If you're looking for a presentation, Dr. Ochoa-Galindo's got you covered.
Yeah. English or Spanish, I can do both. So.
All right, perfect. Inglés o español.
Yeah, exactly.
I've been practicing.
Nice.
So speaking of presentations and all that fun stuff, well, during my research, I found out you are an incredibly busy clinician, because on top of all that stuff, you also do consultation work. Right?
Yes. Yeah. And so that's a nice thing about, again, when you're independently licensed, sometimes they just need you a few hours here, a few hours there, right? And you offer your services as needed. Right now I'm working with is in Evanston, Childcare Network of Evanston.
Oh.
And so it's a program where they work with different daycare centers, and it's in the Evanston area. And if they identify whether it's a child's mom or the actual child or even a sibling that is experiencing some stressors, then if they're interested, they'll do a referral, and then there's a team of us as independent consultants, and just depending on who has availability, the schedule, bilingual if they need someone that speaks Spanish, then they'll send the referral over. And what's really nice is it's through a grant. And so let's say it's the mother of a kid in daycare, and then her sessions are free. Like she doesn't have to pay for them. And she gets at least 6 sessions of like not crisis counseling, but it could be, or just regular counseling. So that's some of the consulting work that I'm doing now. It's a little slower right now, but I was also working for Easter Seals of Illinois.
Oh wow.
That one was right before I got pregnant, though. I was actually much more active. Right now I'm not it's been a while, but with them, it was a lot of mental health consulting. So again, going to daycares or Head Start programs and doing, classroom observations, teacher trainings, parent workshops. And the same thing again, a lot of, if a parent had a child in that program and they were experiencing, some issues, they could receive counseling free through, the Easter Seals, like agreement that they had with that daycare center. So it was, the nice thing about consulting is that it's on your own schedule. So it's kind of like, well, when are you available? And so that's why, at one point my husband's like, I don't even know what job you're going to. Because I had like 3 or 4, but I'm like, because a lot of it was just like the consulting that, this month they need more, or this month I only have a few, so it's always nice to kind of going back to the blood, sweat, and tears of grad school. I'm like, hey, I pay, I earned this. I get to like make my own schedule, and I don't want to work too early in the morning. I'm not, I mean, that's kind of, the perks of when you're on the other side, right?
Wow.
Of being done.
Yeah, literally. You hear it here first, folks. Do not sell yourself short, because you can teach at universities, look at private practices, do consultation work, do
There's a lot.
Yeah,
There's a
lot.
lot of options. And one of the things that I always say is that it's not easy. I mean, there was a lot of times during my master's program when I was doing my internship, I was working and doing my internship. I mean, we've all been there where you're working and doing, so you're working like almost 60-hour weeks because you're that's what you're doing. And you sometimes feel like, is this even worth it? Like, it's not even, like, I'm tired mentally, because this is a very mentally draining profession if you don't self-care. Right. So you really have to self-care and remember that it will pay off. Like, this is in the short term, but you'll like reap the benefits later. You just have to kind of stay focused, but which is why I think, and I'm always preaching the self-care to students or clients, like, you have to self-care in this field. It's just, you're going to burn out way quicker, and then, or compassion fatigue, if you don't take care of yourself, like practice what you preach, basically.
No, it's true. And to pick your brain just a little bit, so how did you get into consultation work? Was it something that someone just approached you with and you're like, yeah, I'll do it?
Again, just but the funny, I don't know if it's just me, but I get where that it's on Indeed or LinkedIn, like I'll just, you get like what is it, like what's the, I'm drawing a blank, like
like the alerts.
Yeah, the alerts. Thank you. I can think of the word. Just alerts that, someone, because I'm always looking like, oh, mental health consult. So I'll put mental health consulting as a job search, as a keyword, mental health consulting, Chicago. And then whatever comes up, and some of them are, like, okay, that's not really. And then others, you're like, okay, that might be something that, maybe I can do. And so that's kind of how I found Easter Seals. Again, I'm always just kind of, because you never know, people are always looking, or a new position opens up, or they just again want to hire someone for a few hours here and there, and it adds up. The only thing about doing consulting work is that you are your own, you're like your own W-9, so you have to pay your taxes. So that's the only, like, you have to be like diligent about saving, because they're not taking away any tax. And so when come tax time, you got to pay that, and if you didn't save, and you made a good amount of, you earn decent, that's a, you're gonna be like, oh, I gotta pay all that and taxes that. So I actually, I prefer when they take the tax, they'll take it out already, because then that way I know that that's mine, and I don't have to save it for late, save a chunk. So that's the only, like, you really have to kind of be, like, disciplined in that.
Oh no,
Of
taxes are the
saving.
bane.
Yeah.
Taxes are the bane of everybody's existence, right?
Yeah. And so that's the only thing, because you're hired as your, your own, independent consultant, then you pay your taxes. Sometimes, depending on the company or the agency, they might do a W-2, but most times you got to take care of that. So
Well, you heard it here first, folks. If you do go into consultation work, save a chunk of that, or
You
pray
just
that they
you
take
just
the
have
taxes
to
out ahead, right?
exactly because they don't tax it. So it's almost like you have to like maybe set it up where they automatically your bank takes it out, if it's a direct, they and you just because it does come back and bite you. I've learned the hard way. I'm like, oh my goodness, that you're thinking, oh, next check I'll save some. Next and you're like, yeah, okay, no, good. How did that go? So again, just finding a system that works for you.
Oh, definitely. So, speaking of systems, again, segues into our next question. Okay, kind of not really, but I know you talked a lot about teaching ESL courses in Mexico. So, what was it like teaching ESL courses, and how did that opportunity come up for you?
Idealist.org. I believe that's still
Oh,
a website. So if you go on idealist.org, it's well, there's jobs opportunity and then
mhm,
also like volunteer opportunity. So I don't even know. Interesting, when I was doing my internship for my bachelor's at the domestic violence agency, now that I think of it, I think the coordinator that I was working with there, she mentioned that website. I don't remember why. But then I'm like, oh, let me go check it out. Like, I guess for jobs, and I don't know how it just popped up, or and I'm like, and again, there's no way they're gonna. That's in Mexico. Like, what is that sounds like so, and not just in Mexico, but there's a lot of for people that are interested in traveling and making money. Whether if you feel teaching English in China or teaching English in like just different countries that need it, that are looking for those teachers, ESL teachers. So again, I just found the company or the organization, and I just sent I again just applied and just said, because they needed a teacher in the town or the city that my parents are from. Because that's the thing. The thing is that, and again, it's funny because I kind of put conditions because they usually just hire you and they'll send you where they need you in Mexico. It
oh,
could be any remote, urban, that's where
mhm.
they need you. But I was kind of more like, like if I'm gonna go, these are my conditions. Like you don't have to find housing because they have to find housing for you. I'm like, I already have a place because I have family, and so I guess they really needed someone because they accepted my condition of working in the city that I wanted to. Because and again, I'm like, well, if they say no, they say no. Again, I get it.
Mhm.
So, and that's just how again. So it's interesting because I graduated. I was done in December 2002 with my bachelor's, and by February 2003 I was in Mexico teaching. So it was
Oh,
I didn't even walk in my but like because usually you don't walk, there's no ceremony in the fall, it's in the spring.
mhm.
So it's like people are, you didn't walk. I'm like, I had my degree already, I was already working, I mean, I wasn't going to come back just for I mean, at that point, priorities, right? It's different. But
Mhm.
it was very, it's intimidating at first because it's like, oh my, you're teaching a whole language. I'm like, do they get it? Am I doing a good job? And obviously you own your craft and you learn and you take your own courses, but yeah, it was, and it's interesting, but it's interesting because you could eyes again
Mhm.
nonverbal, kind of like with
Mhm.
counseling. I could tell in a group of 20
Mhm.
just by their eyes how whether they got it, they knew what I was saying. This one has no idea what I'm saying. This one gets it. This one's in la la land. Like, it's so interesting how you start just by their nonverbal communication that they're giving you. So the hard part for them was speaking it. That's always the hard part, I think, for most people that are learning a foreign language. They understood it. They could understand it because of the music and movies, and they're
Mhm.
exposed to it much more, but when it was time for them to talk, it was always that nerve wracking for them. And having an American teacher, a lot of times they have a Mexican, or in this case, they have a Mexican teacher that learned English.
Right.
And so, not that that's bad, but again, it is what it is, right? So having an, American, for them, it was, I guess, a little bit more
Mhm.
intimidating, um, but then I would tell them, because I mean, I speak fluent Spanish, but there's still errors that I make with the accents, and so then I'm like, hey, you're correcting my Spanish and I'm correcting your English. So it's like a win-win, right? So
Yeah.
that's how kind of I would try to present it. So, but it was a really and I still keep in touch with some of the students that are now my friends, right now with Facebook and WhatsApp and all that. I mean, it's a very nice, it's easier to keep in touch. And some actually have even visited me here in Chicago. So that's been,
Oh,
yeah. So
yeah.
I mean, it's lifelong friends, I believe that I made. And again, because of that job, I firmly believe that that's why I'm at UIC. I wouldn't be at UIC if it wasn't for that job that gave me the opportunity to start teaching.
All right, nice, very nice. So then, did you also have an opportunity to do counseling in Mexico too, or was it just teaching ESL?
Informal, more informal, but yeah, not, it was more just the teaching. Yeah, but they obviously my background is psychology, so that would come in handy, but not formally, not at that time.
Okay. Well, I know you have already shared, right? But I guess yeah, you do have also a wealth, a well of knowledge and information, right? That thankfully you've imparted at least some of that here with us during this interview. But is there anything that you would like to tell people that are starting out in the field or have been in the field for a while?
Yeah, definitely. I mean, kind of what I mentioned before, you have to, take care of yourself.
Mhm.
Like it's I can't stress that enough, and that you can't do more work than the client. And that's a hard lesson to learn. And you learn it the hard way because when you're fresh off graduate, your master's, and you're excited, you want to help, and I mean you still want to do that obviously, but it's hard to, it's easy to kind of lose sight of, hey, like I can't do more than the client. I can't want it more, for them to like do better or feel better. And I always share just a real quick story. When I one of my more important jobs, once I had my master's, I worked at DuPage County Health Department, and that was really like my master class of, like, because I was in the child and adolescent team, and I was the only Spanish speaking clinician. So again, I was busy. That there's a big Spanish speaking, Bensonville, Addison, Glendale Heights, and I would translate a lot when my clients had to meet the psychiatrist, because I would translate for the parent. I didn't have to do that because we have they can call the number, and there's a translating service. But for me, it's like, no, it's not the same. They're just going. I can add more to it. And so I had to translate one time in a session in an evaluation with the psychiatrist. They had taken for, again, she's busy. So we had been waiting and waiting for this appointment. And finally, and I think I had some sort of food poisoning
Oh,
that day, because I, woke up and I'm like, oh, and again, again, because you think that, oh, I need to be there, even though I didn't, because she could have just used the number, the translating service that we use. She could have called and put him on speakerphone. So no, I go and I drive, and it's like, 45 minutes to go to the office. And I had like a jewel bag just in case I had to pull over. And looking back, I mean, I was again new in the field, and looking back, I'm like, well, even that, how am I going to be helpful to someone? If I'm like
yeah.
wait, I can't translate that. Let me throw up. I mean, now I can laugh at it, but so I get to the office, and mom canceled the appointment.
Oh.
And this was before like cell phones were really, like it wasn't, but
Mhm.
that feeling of, I cannot believe that I did this to I put myself in this situation, and I think, oh, it's so important. And then mom, just whatever reason, she had to cancel. And I'm like, never again. That was, and again, sometimes you need that wake up call. You need that, like, because again, people can tell you, and you're like, yeah, but that was the first and the last time that ever I'm like, no, never again, because it's ridiculous. Like, I can't, it will get, I think sometimes we feel like we're too, and not in a bad, we just feel like we're like, irreplaceable. Like, we're not, if I don't go to work, it will, what gets done will get done, and what doesn't get done, it doesn't get done. And it's okay. So I think it's because, again, it goes back to not wanting to take days off or not wanting to use your vacation. That's what it's there for.
Yeah.
And there's a lot if we research, a lot of people feel like I need to be at work. No, not, and if anything, the pandemic taught us that no, not really. Like it will get done. Like now there's the option and many to do remote stuff, but it's not worth it. It's not worth you sacrificing family time, vacations. I think that for me is, and this is what I think a lot of my students kind of don't understand. I tell them, but at UIC, and because oh, she's too relaxed and she's too, it's because you know what? I don't sweat the little things anymore. It's like this generation of college students, it's so competitive now. I don't remember it being that competitive for graduate school and your GPA. They're so with the GPA, and I'm like, it's not, I mean, I'm not saying it's not important, don't get me wrong, but they look at more than just your GPA. It is not like they look at the whole like person, right? Like experience and volunteering and whatever. And so I think you have to enjoy the journey. You can't be a zombie, because this is what I see a lot with my students. They're falling asleep in class. They're taking 5, 6 classes and working full time. And then you wonder why you're tired. I'm like, seriously? Like, I mean, you're just putting yourself through the grinder. I mean, it's not, how is that enjoyable? How is that like really like being present in the class? And so it's a very, it's, I feel for them because I don't remember it being that competitive. I don't know your experience, but it wasn't that like, like they're already thinking about, I'm like, you're just, you're a sophomore. I'm not saying you shouldn't think, but you still got time. Like, it's
Right.
just very, and again, that's, I think, where's a lot of the anxiety and mental health too with college students. That's just,
Mhm.
they're not taking care of themselves. And so that's the thing that I would say is, please, like, it's not worth it. At the end of the day, you will find a job. You will find, it's not, it will work out. And I think it's hard for, I think, or, new clinicians or even graduate students to maybe really hear, like hear it, but also kind of accept it, that it's, you can miss work.
Mhm.
The world's not going to end because you missed work.
Yeah, that's true. The world is not going to end because you miss work. They have protocols and policies in place. They will find someone to cover, or they'll just have them reschedule.
Yeah. And I know it's hard because, again, the line of work that we do, especially with counseling, clients, of course you get, you care about your clients,
Mhm.
but it's also good for clients to not always feel like you're not always going to be there either.
Mhm.
And so yeah, definitely it has its challenges, I think, and the boundaries, right? Leaving work at work,
Yeah.
quote unquote, and not making yourself so available to clients either, because that's not always, productive. It can be counterproductive. But I think
Right.
a lot of that stuff, again, you just learn along the way. It's trial and error, and sometimes you have to, kind of get burned to realize, okay, yeah, they were right. The whole I didn't
Mhm.
want to, told you so, but okay.
Right, exactly. And then
Yeah.
that is true. That is true. I feel like a lot of, especially within my graduate journey, there was that sense of competitiveness, especially with getting into NIU, one of the best counseling programs here in the Midwest. And ultimately, it's like, yeah, we're trying to beat out other people. And then also afterwards, there's that sense of urgency of, okay, I've been told all this time I'm not going to make a lot getting out of grad school. So I do have to find a job immediately out of there. But there's all these other people applying for the same job I'm applying for. And in that sense of I need to get something even before I graduate, right? And all that
Yeah,
stuff.
yeah. And I don't know, again, if it, like, now that we have, like, everything is online web search, and you can
Mhm.
look up salaries, and I actually just went over this with two of my classes of, like, how much do you make entry level, give or take, obviously, right? I mean, again, because it depends whether you're private sector, working private versus public versus government, but some of the what like Indeed is telling them, or Google, I'm like, that's wait, I don't think that's that for like for bachelor's level, for example. I'm like, I don't, like, so I think it definitely can, discourage.
Mhm.
And I told him, I said, I mean, if you're doing this for money, then you're in the wrong field. Yeah, you can make these, of course you got to make a living. You're not, starving artists per se, but it shouldn't be about the money either, because this is not the profession, of what like engineers make, or a airplane pilot, or
Mhm.
maybe, I don't, maybe eventually, but kind of again what your priorities are and your values and why you're in this line of work, right?
Right.
But obviously, yeah, you want to pay your bills. I mean, it's finding that balance,
Mhm.
right? So definitely, yeah, it is much more. I tell my students when I got my bachelor's, and of course this is 2000, early 2000s, that was enough for a while, it seemed. Now it's like, and eventually I took 3 years off and then I went back to school, but it seems like
Mhm.
now, whether you just take a gap semester or a gap year, but it's like, no, 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 I need to already be getting my master's. I'm like,
Yeah.
which again, to each their own, but you also need field experience. It can't just be all school, 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 school. You know what I mean? Like there has to be, again, like some field work, field experience too.
Right.
Yeah.
Exactly. Not just waiting to your practicum or your internship to get it.
Right.
Mhm.
Yeah. I mean, it has to be, you got to find something. And the nice thing that I do tell them a lot, and it's interesting because again, a lot of the academic advisors, I don't know if they don't, I don't know, but of like how master's programs are very different than bachelor's. Like you're just going once a week at night, or you're going, twice a week, but it's at night. It's just 2 classes depending on the program. Whereas, with bachelor's is usually during the day, 4 or 5 classes, or so I'm like, you are able to have more of a balance of being able to work and then go to school at night. And it's a little bit more doable,
Mhm.
obviously, if, again, self-care and all that. So yeah, I mean, that's what I think, all of that, but definitely the self-care part, because it's so easy to burn out, and then you're not useful to anyone if you're crabby, grouchy, and you're not practicing what you preach, you know?
Right. That is true. That is true. You definitely got to practice what you preach because clients will notice that.
Right? Oh yeah. Oh yeah.
Mhm.
It's like, well, they're right. I mean, how can I be over here, telling them to go to sleep at a reasonable time when I'm over here, like not doing what I should be doing, following
Mhm.
my own like advice.
Right. Exactly. Staying up till 3 a.m. doing notes is not fun at all. Would not
All those
recommend.
notes. God
Right.
bless. Yeah, I hear you. No matter how quick you try to do those notes, right?
Mhm. All right. So then, is there anything, well, before we get into the most important question, the second most important question, right? Is there anything that you would like to say that I haven't had a chance to ask you about?
Oh, I mean, I think your questions were like pretty, right, but covered a wide range of topics. But if anything, I guess I would just say, again, making sure that you network, and
Mhm.
that you, as a student too, like connections and talking to professors, and because then they'll come and they want a letter of recommendation. I'm like, yeah, you were in my class, but you never raised your hand, you never asked to see, you never talked to me before.
Mhm.
It's like, um you know what I mean, like, then what am I going to say about you? Like, you just were a student in my class. So I think it's, you know making sure that we, again, kind of more collaborative spirit instead of competitive,
Mhm.
of like, even with colleagues, and sharing, and helping each other, whether it's at work, or in graduate school, kind of more, because it's, I mean, I don't know if you agree, it's a small world in this field. It's
Yeah.
eventually you're going to run into, whether it's at a seminar, at a job, and or like that 6 degrees of, like, if you looked at LinkedIn,
Mhm.
like, oh, they know each other. It's a very small world, like in the counseling, social work. And so I
Mhm.
think, again, just having that network, and because that, you never know where that can take you, whether it's a new job opportunity, or even just collaborating, consulting. So definitely being more intentional about, like, talking with your peers or with your professors, or just,
Mhm.
making connections at work, or networking.
Definitely. Networking is 100% important. You definitely need it.
Definitely.
All right. So now the most important question of the night, where can people contact you or find you if they want to learn more, get more information, or have any questions for you?
Yeah. I mean, inmotioncounseling.com. I mean, that's the website for the private practice, inmotioncounseling.com, just
Mhm.
all of it together. And if you go on the UIC website under the psychology department, I'm there too. There's my email address and, like, my profile.
Mhm.
And so that's another way, but definitely, either way, either one, either through the inmotioncounseling.com or through UIC psychology department, I'm there in both of them. So, LinkedIn, I mean, again, it's there's so many now, right? LinkedIn is I have my LinkedIn page, and that's another way that people can reach out.
All right, perfect. You hear it here, folks. Go on any of those to reach out to her. If you want to be taught by her, definitely go to University of Illinois Chicago or North Park University. Right? If you want to work with her, apply to In Motion Counseling. I don't know if they're hiring, but
Right? I mean, we're always looking for, it's part-time. I think part-time is 8 hours a week,
oh yeah,
or eight
very
clients,
manageable.
8 clients a week or so. So,
Mhm. All right, perfect. All right, but thank you very much for interviewing. Like I said, we have to do a part two eventually because there is a lot more that I want to pick your brain on. Now that I've heard a lot of these answers, I was like, "Ooh, I want to ask her this," or "Ooh, I want to ask her that." But I want to
yeah,
be
no,
respectful of your time also.
no, definitely. I would be more than happy to come back, and whatever, if it's a specific topic, we can, delve into that, and or if people, want another topic or something that they want me to, further elaborate, I'd be more than happy.
All right, perfect. You heard it here, folks. She's coming back. Boom, got her. All right, but that'll be it for this interview. Thank you very much, Dr. Ochoa-Galindo. We appreciate you coming on.
Oh, anytime. And thank you so much for having me. I appreciate it.
Yeah, no problem. No problem. All right, everybody. This is Coresair Mack, president of the Illinois Mental Health Counselors Association, signing out. And I'll see you in the next video. Take care.